My name is Katie, and I am a fourth-year dental student. Each morning I get up at about 6 o'clock. I'll eat breakfast, take a shower, head out the door, usually catch the bus. As a fourth-year dental student, you don't have quite as much coursework. We actually only have class Monday and Wednesday from 7:30 to 8:30 about, and then we have clinic after that. Clinic can be anything, any range of procedures within the dental field, so you could be doing some restorations, so fillings or crowns. You could be doing some scaling or rip plating or like a deep cleaning for patients. We typically see patients, one patient in the morning and one in the afternoon for about 3-hour appointments. The appointments are typically longer at the school because we need to have quality checks in between each of the steps for the procedure. After the first patient of the morning, we typically either can just go to lunch, or if you have impressions to pour up and make models from them, we go to the lab and do that. For lunch, we can either bring our own lunch, which is probably pretty common because you're a student and you don't have very much money, so pack your own lunch. Typically, lunchtime is a time to kind of kick back and relax. Both the third-year students and fourth-year students do pretty much the same thing because we've both gone through the clinical or the preclinical portion of our education, and so we should all be fairly competent. Obviously, the fourth years are a little bit faster, but everybody does the same procedures. After the second patient leaves, we can typically leave ourselves and go home. Otherwise, we have lab work to do. We can stay in the lab until 9:30 at night, working on either setting our denture teeth, creating dies for the lab to create a crown off of. Typically, I would leave campus at about 4:30. I get home at about 4:30, 5 o'clock, and make supper. I've actually been getting to bed quite a bit earlier this fourth year because we don't have as many classes, so I don't have to stay up and study. I get to bed probably about 9:30, which is much different than first and second year. Initially, what I liked the best was fixed prosthodontics, which is bridge work, crowns, things like that. I had my oral surgery rotation this past summer and decided that I liked what was going on in there, so I actually applied to oral surgery programs. For specializing oral surgery as a specialty, you apply and are invited possibly to interviews. I might go to Portland or Jacksonville, Florida, Detroit. I don't really know quite yet.